Is back pain controlling your life? Is back pain slowing you down from doing the things that you enjoy most? Is your back pain every morning when you wake up causing you to go reach for the medicine cabinet to go take some medication because your back hurts? Well, if this sounds like you, this video is for you. And for those that are suffering with back pain, there's a few things that I want you to understand about back pain and what causes it. Like if you've been suffering with back pain for over 2 months, let alone 6 months, let alone a few years, it's more than just a muscle problem. And if it's something that comes and goes and something that you could look back and say, oh, I've had back pain for many years, it's something that's more serious than just a muscle problem. So stop stretching and start getting answers by getting a thorough evaluation of what it is that is causing your lower back pain. Now, that may mean going to a professional to have x-rays taken so that you can further evaluate what's going on with the health and structure and alignment of your spine. Far too many people just chalk it up as, I'm getting older, it's just a muscle problem, it'll go away. And these are the things, as we continue to wait, that cause such problems because we allow the underlying situation and the root of the problem to continue to worsen without it ever truly being addressed, because we think more stretching, more Tylenol, more Advil, more ibuprofen, and just maybe some heat and rest, and it'll get better. Now that's all well and good. And there are times when you'll strain your back and muscles will get tight and that'll cause some discomfort and pain. But a few days go by and it goes away. And I understand that. But there's a difference between having a back strain from some work that you've done, shoveling snow, doing landscaping in your yard, or even some weight training, that would be, a reason to think that, hey, I strained my back. But when it's consistent and there's a pattern to it, there's more than just a muscle problem going on, and that is something you should get looked at. I see far too many people walk into my office and they think nothing of their back pain. And most of us are what we call minimizers. We just minimize the problem because we really don't want to hear what is actually wrong, especially if it's something serious. But I'm here to tell you, as I have seen over my 20-year career, probably over 40,000 x-rays. And looking at x-rays each and every day in my practice, it doesn't cease to amaze me on the problems I see in people's spine that just goes either undetected, overlooked, or just kind of pushed under the rug because we think it'll go away. And I'm here to tell you, spinal problems can be such a problem for people as they get older that it just robs and steals your quality of life. Don't let that be you. When we look at the spine and we look at x-rays and we see degenerative disc disease and degenerative joint disease, whether you're 30 or whether you're 60, okay, we see it across the board. It is not normal to have degenerative changes in your spine that are causing you backaches, physical limitations, not enjoying life, where you have to worry about your back all the time. So I'm here to just, express my concern for you. If you do suffer with back pain, stop ignoring it. Too many people walk into my office that if they only would have addressed it months earlier, years earlier, in the right way, they wouldn't be in the position they're in today. And trust me, I see the most, advanced cases of people that have let it gone so far that they have trouble walking, they're losing their balance, and life is no longer enjoyable. Don't let that be you. Get your spine looked at by a trained professional, and don't accept the fact that more physical therapy, more drugs, more muscle relaxers, more painkillers, and even injections are the answers to mechanical problems that are occurring in your spine. A mechanical problem needs a mechanical solution. Mechanical problems cannot be solved with a chemical solution. And we have to understand that because far too many people continue to suffer, and all they do is take medications, pain pills, muscle relaxers, and they're not doing themselves any good. We use state-of-the-art equipment to help diagnose the problems. We use state-of-the-art equipment to help treat underlying issues in the mechanical problems we find in the spine through spinal decompression therapy, advanced class 4 laser therapy, shockwave therapy, which is sound waves that penetrate into the tissue to stimulate vascularization and blood flow and healing. And that's what it's about. Here at Power of Life Advanced Spine and Health Center, we are all about helping the body heal. And healing is what needs to take place for you to overcome these chronic issues. And the longer they're there, the harder it is for them to reverse. So if this touches you and you do suffer with back pain, we welcome you into the office to get a thorough evaluation of the alignment and mechanical problems you may be having in your spine that do not get addressed or get missed because it's only just another pill or another round of physical therapy that's not addressing the root cause of your problem. Our goal here in our community is just for you to learn and understand and get another angle or perception of what it is that's going on in your spine from a trained professional like a chiropractor that has studied the spine for over 4, 5, 6 years to know and understand what it is that can help you overcome your chronic back pain.